Hello, this is Christopher Mitchell from Aspen University, and today I'm going to be demonstrating an intramuscular injection on a patient. And standing in place of my patient today is going to be this onion here. So the first step that we're going to do in preparing an intramuscular injection is to prepare the medication using aseptic technique. So I've already performed hand hygiene and I have clean gloves on. We want to check our MAR with the medication being given. This is going to contain my medication here. This is my MAR. So I'm going to check the medication with the MAR, and I'm going to do this twice just to double check and make sure that we're getting the right medication with the right person. So we're given a flu shot injection, intramuscular, and we're going to be doing that into the left arm. So I'm going to approach my patient. I'm going to introduce myself and explain the procedure. I'm going to provide patient privacy. I'm going to check our medication that we're giving to make sure it's correct. It's the correct patient and it's the correct medication in our MAR. So I'm going to pretend that this is our ID band here. I'm going to check my patient's ID band with our MAR, make sure it's the right person twice. I'm going to check that we're giving the right medication twice. It's going to be 1 milliliter of flu shot injection, intramuscular. The right person, the right medication, right medication, right person, right medication on here, the right person on here. So we've double checked comparing the MAR with the patient ID band. We're going to provide our privacy. And I'm going to ask the patient at least 2 identifiers. So can I please have your name and your date of birth, please? They would respond with their name, date of birth. I would make sure it lines up correctly with our MAR. It's the right name, right date of birth. Looks good on the patient ID band. So we're ready to move on to the next step. Everything looks good with the MAR. I've checked everything several times. We're going to do it one more time at the bedside, make sure everything looks great on the MAR, on the patient ID band, on the medication itself. It's the right milligram. The right dose is going to be administered to the right patient. We've already identified using 2 patient identifiers. So once that is done, we've got everything figured out. I'm going to ask the patient about any allergies. This patient reports no allergies to me. I'm going to offer education on the injection we're about to do with the patient, and which is going to be a flu shot, which is going to help the immune system against the flu virus. Make sure the patient is aware of that. I'm going to make sure the patient is fully educated on the medication, ask the patient if they have any questions. Then I'm going to instruct the patient that the injection may cause some stinging or burning. So once I've done all that, I'm going to remove these gloves I used to prepare our injection. I'm going to put on a pair of clean gloves here. But before I put on the clean gloves, I'm going to make sure I do my hand hygiene. Once your hand hygiene is done, you can go ahead and put on our clean gloves. So our gloves are on. I'm going to grab my syringe here. I prepare medication. Generally, our medication would already be prepared, but for the sake of the video, I'm going to ensure that we have 1 milliliter. Now I'm going to cover this and put it to the side. So as you can see, our medication is prepared into our syringe. We have the cap on for safety. So once everything is all ready, I'm going to select my injection site, which is going to be here on the left arm. I'm going to Ensure the patient is in a comfortable position, and I'm going to begin by cleaning the site of injection with an alcohol swab in a circular motion for about 10 to 15 seconds. Good. Once that is complete, you want to allow that to dry and keep that there. We're going to allow that to dry. I'm going to make sure, double check that our patient is in a comfortable position. I'm going to usually hold our swab between the third and fourth fingers of my non-dominant hand so that it's ready to go. Once I have that ready to go, I'm going to grab my needle, and we're going to take the safety cap off of it by doing so here. Okay, once we've taken that off, we've had the site cleaned. We have our gauze between our third and fourth finger here. I'm going to position my non-dominant hand on the patient's left arm, under the shoulder here. And I'm going to pull the skin 2 inches. I'm going to pull it, about 2.5 centimeters actually. So I can get the Z-track technique. So once my non-dominant hand is pulling the skin, I'm going to go 90 degrees when I inject the syringe, nice and firm, while I'm still holding the skin. Just want to go ahead and do that. All right, we have it in. I have it in 90 degrees. I'm still holding the skin, 2.5 centimeters. While still holding the skin, I'm going to grab the lower end of our syringe barrel. I'm still holding the skin in place. And what I'm going to do is stabilize it. I'm going to move my dominant hand to the top of the syringe. I'm going to pull back on the plunger for about 5 to 10 seconds. If I notice no blood appears, I'm going to slowly inject our medication. 90 degrees in. Once our medication is injected, I'm going to wait about 10 seconds. Then I'm going to slowly withdraw our needle. Good. I'm going to put my safety cap on. I'm going to dispose of that. I'm going to apply gentle pressure to the site that we injected. Very, very, very gentle. I'm going to make sure our needle is discarded. If needed, I'm going to grab my alcohol swab, put some pressure here. If there's any bleeding. If we need to put a Band-Aid there, we will. If there's any bleeding, stop bleeding, we usually will apply some pressure to the site. Make sure our needle is discarded properly, which I've already put that in this sharps container. I'm going to remove my gloves. Ask the patient if they're in any pain. I'm going to discard the gloves, perform my hand hygiene. Now I'm going to wait with the patient for a few minutes just to ensure there's no reaction to the injection. Make sure there's no allergic reaction to the injection. If there's nothing there, once you waited for the patient for a few minutes and there's no reports of reaction or pain, then that's it. That's the whole process. So you want to make sure the patient is comfortable, they're not feeling any pain. If that's all good, and then we're all done. So thank you very much.